Hello, everybody, and welcome to our webinar. Today, we want to focus on the differences, the score differences that we as clinicians sometimes identify when we administer what appear to be tests that measure similar constructs. So we want to think about these score differences. And if we were to administer, for example, the PLS-5 and the CELF Preschool-2, the Preschool Language Scale, the 5th edition, the Clinical Evaluation of Language Fundamentals Preschool, we might find that the same child might earn different scores. And it's going to be our job then to try to explain these score differences. And certainly there may be times when the language performance, the child's performance, actually is different, but it also could be that there are other factors that might explain those differences, for example, between the PLS-5 and the CELF Preschool-2. So the focus of our webinar today is really to think about the different factors that could contribute to different scores on the PLS-5 and the CELF Preschool-2. Before we get started with the actual content of the webinar, this webinar is being presented, and you are able to earn ASHA CEUs for attending this webinar. In order to earn CEUs, you must attend the entire 60 minutes of the live session, and you must also complete the attendance sheet, but only if you are viewing this webinar with more than one person at your site. If you're the only person at your site, you do need to complete the ASHA participant form and the evaluation form. And the forms, as well as the handout, were sent to you in the reminder email that was sent by Sherry Locken. You will need to mail the forms postmarked no later than 5/10/2019, a week from today, and the address is here. If you have any questions about CEUs, Darlene Davis would be your contact person, and her email address is here. We also have things that you don't do, but certainly we want you to follow all of these things here. And we also included these do's and don'ts for submitting forms for ASHA CEUs in your handout. I also need to provide some disclosures. In terms of financial disclosures, I am employed by Pearson Clinical Assessment, which is the ASHA continuing education provider for this session. And I have no relevant non-financial relationships to disclose. I also need to let you know that the Pearson Assessment Division, the sponsor of this webinar, we develop and distribute assessments and intervention tools for speech-language pathologists. I will be covering information about the effective and appropriate use of the preschool language scales, the 5th edition, PLS-5, and the clinical evaluation of language fundamentals, preschool 2nd edition, which were developed by Pearson Clinical Assessment. I will be referencing no other assessments during this presentation. Again, before we get started, just to give us an idea of who has joined us today, if you would identify which of the following roles best captures your role. Are you an administrator, a consultant, speech-language pathologist? Maybe you are on the faculty at a university, or maybe your role falls into a different category, in which case you would select other. And I know we probably have a few psychologists who might be joining us today. So in terms of who is here today, it looks like primarily speech-language pathologists who would be the professionals or clinicians who would typically administer and score and interpret the PLS-5 and the CELF Preschool-2. Thank you so much for your feedback. In terms of the order of the agenda today, for the first 10 minutes of our session, I'm going to focus on the purpose and design of the PLS-5 and the CELF Preschool-2. And as I'm talking about the purpose and design of these two assessments, I want you to keep in mind the focus of our webinar, which is really trying to understand the factors that could theoretically explain score differences, why a child might earn different scores on the PLS-5 and the CELF Preschool-2. Then we will move to a discussion of the test format, looking at the format of the PLS-5, the format of CELF Preschool-2, and thinking through how the format of the test could impact the child's performance. We want to spend about 20 minutes looking at some case study information, thinking through the interpretation based on what we know about purpose and design and test format. And then we'll culminate by looking at the test results, thinking about the interpretation of the test results, and then looking at factors that could explain score differences. And then toward the end, we will look at any of the questions that are in the chat box and answer those. At the completion of this webinar, you will be able to list at least two differences between the PLS-5 and the CELF Preschool-2. You'll be able to explain one reason why the test format differences can produce different scores, and then also describe at least two differences in the type of data that you'd be able to collect with the PLS-5 and CELF Preschool-2. And then finally, explain why there are score differences between the two tests. So to get us started, let's look at the purpose and design of the PLS-5 and CELF Preschool-2. So I want us to think through PLS-5 in terms of its purpose, CELF Preschool-2 in terms of its purpose. And when we think about the purpose of the PLS-5, the preschool language scale, that instrument was designed to identify young children with a language delay or a language disorder that interferes with communication in their environment. So you're thinking about young children, whether or not there might be language delays for infants and toddlers, or maybe a language disorder for children who are beyond that 3-year-old age range. We also can obtain information on articulation. So you're thinking about language, you're also thinking about speech, the production of language. When you look at the CELF Preschool-2, like the PLS-5, the CELF Preschool-2 was designed to identify children who might have a language delay or language disorder. But when you think about the functional environment for the CELF Preschool-2, you're thinking about the classroom or the mainstream classroom. So whenever I think about the purpose of a test, I always think about what that instrument can tell us about the demands of the child's functional environment. So when you think about CELF Preschool-2, you're thinking about the functional environment as being the classroom. When you think about PLS-5, certainly the classroom is an important component as well when you think about children toward the upper end of our standardization age range, but you're certainly also thinking about the home environment and the community when you're thinking about the PLS-5. So when we consider the features of PLS-5 and CELF Preschool-2, you're looking at PLS-5 as providing information about developmental communication skills. So what are your expectations for a child who might be maybe 16 days old or 3 months old compared to maybe 7 years old? In terms of developmental communication skills, what are your developmental expectations? And using the PLS-5, you'll be able to determine whether or not this child this child's communication skills are consistent with developmental expectations. The PLS-5 can assess children who are pre-verbal when you think about birth through 7 years, 11 months. Certainly the youngest in our standardization age range will be pre-verbal children, but the PLS-5 is also used with children with low language ability. And theoretically, in terms of the functional environment, you're looking at children who might be functioning in supported classroom environments, whether you're thinking about children who are receiving early intervention services or who might be in early childhood programs, in supported programs related to early childhood. Those would be the features of the PLS-5 when you think about the characteristics of the children and you're trying to select an appropriate assessment. Certainly the PLS-5 would be an appropriate assessment given these characteristics. In contrast, when you think about CELF Preschool-2, we've already determined that both will provide information related to language, to diagnosing language delays and language disorders, but the CELF Preschool-2 will provide an in-depth assessment of semantics, morphology, and syntax. Also, when you think about the age range for the CELF Preschool-2 starts at 3 years. So you're thinking about children who are enrolled in preschool programs for 3-year-olds and going up through age 6 years, 11 months. This is a tool that is used to assess language of children who use multi-word utterances. So not necessarily that they're speaking in complete sentences using correct syntax, but that they are using multi-word utterances. We also think about the CELF Preschool-2 in relation to the mainstream classroom. So again, when you think about the functional environment and you think about the demands of the mainstream classroom, the CELF Preschool-2 theoretically will provide information that will allow you to determine if this child is demonstrating the language skills, specifically semantics, morphology, and syntax, that would be required for success in the mainstream classroom. So when you think about these features, both of these tools are used for similar purposes. Both the PLS-5 and the CELF Preschool-2 can be used to help you diagnose, as I mentioned, either a language delay or a language disorder. Also to help you determine the child's eligibility for conceivably direct specialized instruction or specialized supports, whether you're thinking about specialized supports in early intervention programs or maybe in speech language programs when you're thinking about children in preschool programs. So when you think about both PLS-5 and CELF Preschool-2, you are looking at being able to diagnose, to say that the child does have a language delay or language disorder, and then to determine based on your diagnostic information, based on your diagnosis, that the child will need specialized supports in order to continue to develop language skills or to facilitate the development of language skills. So you're thinking, for example, here, when you look at PLS-5 and CELF Preschool-2 in terms of diagnosis and eligibility, similar purposes. Also, both will provide information on strengths and weaknesses. When you think about the strengths and weaknesses, the PLS-5 will help you to identify the child's receptive and expressive language skills, and there are certain specific areas for which PLS-5 will provide information. Similarly, the CELF Preschool-2 will provide information on receptive and expressive language, but will also provide information on specific areas of language impairment. For example, I mentioned already semantics, morphology, and syntax. So CELF Preschool-2 will help you to drill down to kind of identify in which specific components of language the child might be struggling. Both tools will allow you to use the child's strengths and weaknesses, the profile of strengths and weaknesses, to identify appropriate interventions. And both tools will provide information, growth scale values in particular, that will allow you to assess the efficacy of treatment, the efficacy of interventions. So I want to say a few words about PLS-5 first, and then I will go to CELF Preschool-2. So I mentioned before, in terms of the PLS-5 and its purpose, you're really thinking about PLS-5 as a broad survey. So you're looking at developmental language skills, and the components that we use to survey developmental language skills would include standardized scales that assess both auditory comprehension and expressive communication. There are also several supplemental measures that we can use to get additional information about the child's language development. The language sample checklist is one that is useful when you think about being able to identify the child's spontaneous utterances beyond the standardized information that we collect for auditory comprehension and expressive communication. In addition, we can get information on the child's production of language or speech. The articulation screener will provide us with information to determine if further articulation testing would be needed. And then the home communication questionnaire. Sometimes when we're working with a child in a clinic setting, for example, it's important for us to understand how the child uses language to communicate in the home environment. And so the home communication questionnaire will ask the caregiver and will allow the caregiver to present his or her perspective of the child's communication behaviors in the home. So when you think about the record form for PLS-5, you're looking at certainly auditory comprehension, expressive communication, and those two combined to give us a total language scores. And we'll be able to derive standard scores, and we'll talk more about those when we look at interpretation for both auditory comprehension, expressive communication, and total language. Then in addition, we'll be able to derive a raw score for the articulation screener, and we'll be able to determine based on this raw score whether the child's articulation is typical or whether further evaluation might be indicated. For the language sample checklist and the home communication questionnaire, based on the responses, we'll be able to determine whether or not the information from the language sample checklist reinforces the standardized results from PLS-5, and similarly for the home communication questionnaire. So when you think about all of this information, you're thinking about information using different methods and also using different sources. Certainly getting information using a standardized approach in direct interaction with the child, also allowing the child to produce language spontaneously, here with the language sample checklist, and then also the articulation screener and the home communication questionnaire where we're getting the information, the home communication questionnaire where we're getting information from the parents. Compare that to, when you think about the PLS-5 in terms of its content, because of the age range starting at birth, certainly we're going to be starting with the youngest in our age sample by looking at pre-linguistic skills. And then when you think about the oldest in our age range, going up to 7 years, 11 months, you're looking at emergent literacy skills. So when you think about the content of the test, you're thinking about pre-linguistic skills, like is the child paying attention to the environment? How does the child respond to gestures or respond using gestures? Some of the items assess play, vocal development, social communication, the joint referencing and turn-taking, and then also looking at some of the components that we talked about for CELF Preschool-2, certainly vocabulary, morphology and syntax, vocabulary, the semantics piece, and also basic concept knowledge, and then also the comprehension of language, the integration of language skills, seeing those connections. And I already mentioned the articulation screener. So on the record form for PLS-5, for example, you'll be able to see for our youngest in the age sample, looking at the attention to environment, attention to people. When you look at auditory comprehension, looking at semantics as well as language structure, and then the different components that are involved in language structure, morphology, and syntax, for example, and then for semantics, vocabulary, concept knowledge, looking at qualitative concepts, spatial concepts, quantitative concepts, time sequence concepts. And then the same thing for expressive communication, looking at semantics, the content, as well as the structure of language. So the types of items that you will administer to a child using PLS-5 will naturally depend on the age of the child. So the youngest in our sample will focus more on the first types of items, and then when you start thinking about beyond the age of 3, you're looking more at the importance of semantics and structure really gradually increasing. For the CELF Preschool-2, I already mentioned that this is an in-depth clinical assessment of language skills and that you're thinking about the school-like environment. One of the things that we keep in mind when we think about the school-like environment is the degree of structure in that environment compared to the degree of structure, for example, in the home environment or in an early intervention classroom or in a daycare setting. So there is much more structure in the school environment, and you will see that actually embedded in the tasks for the CELF Preschool-2. So the tasks for CELF Preschool-2 are much more structured than the tasks for PLS-5. There are 7 norm-referenced subtests. There are 2 supplementary norm-referenced subtests, and then there are also 2 norm-reference checklists. So when we think about these subtests, certainly you're thinking about these subtests being used to assess language, but also early literacy. So when we think about children entering kindergarten, for example, and we want to make the connection between language and literacy, we may want some information about the child's phonological awareness, about the child's pre-literacy skills, and the tasks for CELF Preschool will provide that type of information. In addition to information related to language, so certainly semantics, the concepts that I mentioned for PLS-5 are assessed with CELF Preschool-2 as well, the structure of language, morphology, and syntax, but also being able to demonstrate comprehension of language by following directions, again, being able to see relationships between words, and then certainly also looking at the pragmatics of language. One of the things that I think distinguishes CELF Preschool from PLS-5 is that they will both provide the information on core language. This helps us to describe the child's total language, but also will help us to be able to break the child's language abilities into both receptive and expressive language, just like we do for PLS-5, auditory comprehension and expressive communication. But the CELF Preschool will also allow us to tease out the child's performance in terms of the content of language and in terms of the structure of language. So if a child's scores for receptive language are low, for example, Are the scores low because of the semantics, or are those scores low because of morphology and syntax? So you could see how you'll be able to kind of drill down, going from that broad level, looking at core language, and then being able to break that into receptive and expressive, and then for receptive and expressive, being able to identify with which part of language the child might be struggling. So I think you're already starting to see similarities and differences between PLS-5 and CELF Preschool-2. And I want to talk now about the impact of test format on performance. But before I do that, I want to address a question that is coming through in the chat box. What does a GSV actually mean? A GSV, and I'll show you an example of that here when I look at part of the record form from the PLS-5. GSV stands for growth scale value, and the growth scale value effectively tells you that based on a certain raw score, this would be the associated growth scale value or developmental score, if you will. The reason that we like growth scale values is because they allow us to compare the child's performance at time 2 to the child's performance at time 1. So for example, if I administer, let's say, PLS-5, and I get a certain growth scale value, and based on the test results, we determine that these specific interventions are needed, and we then provide those interventions. Maybe 3 months later, we want to come back and re-administer the tool, obtain a growth scale value for that second administration, and then compare the child's GSV at time 1 to the child's GSV at time 2 to see if the child has made progress based on the intervention. So I'll show you what that looks like here in just a second. So in terms of the format of the test, and I want you to think about what the implications of the format would be for the child's performance. So if you think about PLS-5, for example, where you're thinking about these interactive, play-based types of tasks that use manipulatives. And there are some pictures, but these are simple pictures, and the child is pointing, and then there are these question and answering formats. I want you to think about how that particular presentation of tasks would compare to the structured tasks on the CELF Preschool-2, where we do have demonstration items, where we want to make sure the child understands how to perform the task. We have sample items that allow the child to practice the task. But effectively, the subtests on CELF Preschool-2 are highly structured, although they were designed to be child-friendly. Again, some of the items on PLS-5, those play-based tasks, especially for the children at the younger ages. Because of the nature of the PLS-5 in the format, you will be providing verbal cues and supports, more verbal cues and supports certainly than you provide on CELF Preschool-2. Also on PLS-5, you can award credit for interpersonal communication-based scores, whereas on CELF Preschool-2, we're really focusing on the content of the subtest. The other thing about PLS-5 that differentiates it from CELF Preschool-2 is that as the clinician, you are allowed flexibility in terms of the order of item administration. So for example, some of the items are highly interrelated, and you could theoretically present all of those items in sequence even though they would be out of order numerically. And then some of the items for children at the younger ages, can also be scored using caregiver report, can be scored through what we call sometimes incidental observation, and can also be scored by you eliciting that behavior by presenting the task using the standardized procedures described in the manual. So again, you can see that there are some differences in terms of the format. For this one, the CELF Preschool, all of the tasks are presented in a stimulus book, which effectively means that there are these pictorial representations. Okay, let's see if I can get rid of this. These are pictorial representations, and all of the items are scored based on the child's response. So we don't have the input of the caregiver, and like I said, all of these tasks pretty much try to mimic the demands of the mainstream classroom, the demands of the functional environment. So when you look, for example, at the subtests on CELF Preschool-2, when I consider the format of the test, I always think about, so what are the response demands for the child? What is the child expected to do in order for me to know that the child understands the task? So when you look at all of these subtests here, sentence structure, word structure, expressive vocabulary, and so on, and you look at these, the child is going to be pointing to pictures in a stimulus book in response to oral directions. So the child sometimes has to understand complex oral directions and then must be able to use visual discrimination, visual perception to figure out those pictures in the stimulus book in order to select the correct response. In terms of word structure, being able to complete a sentence, which is going to require auditory comprehension, and you're looking at the basic structure, so thinking about syntax and morphology. So for expressive vocabulary, identifying an object, person, or activity. So again, you're thinking about being able to look and say, being able to retrieve from long-term memory some phonological code that is associated with the object or the activity. So some of these tasks you could see where the memory component is really important, the ability to understand increasingly complex oral directions. And then for recalling sentences, for example, again, you're thinking about sentences that become increasingly longer, and the child needs to be able to register what I'm saying, needs to be able to hold that information in short-term memory, and then needs to be able to respond verbally to show me that he or she was able to register and to learn and remember, if you will, what I just said. And then concept knowledge is important for word classes, being able to identify relationships between words, and then to use language, to produce language to describe that relationship. So you could see how these different subtests on CELF 2 have these demands that will be encountered when the child enters school. For phonological awareness and pre-literacy, certainly you're thinking about phonological awareness that would include rhyming, blending, phonemic awareness, identifying sounds, and then also identifying syllables. So the different phonological awareness components in terms of developmental sequence are assessed on CELF Preschool-2. And then with the pre-literacy rating scale and the descriptive pragmatics profile, these don't involve the child directly, but we get the information from a respondent. For example, the child's parent or caregiver will provide information about the child's emergent reading and writing skills and about the child's social language skills. So again, you're thinking about what are the demands of these tasks for this child, and how do the demands of the subtests on CELF Preschool-2 differ from the demands of the tasks on PLS-5. Okay. Okay, so let me take a look now at some case study information, and I'll come back to some of these questions towards the end. So in terms of what we want to say about case studies, I pulled out some information for both PLS-5 and for CELF Preschool-2. And I think when we consider the data, what we're trying to determine first of all, and I always think about that first question, does the child's performance on whatever tool I'm using indicate that the child would meet our criteria for a diagnosis or classification of language delay or language disorder? But then you also want to think about the age of the child, because that'll help us to consider the demands for that child when you think about the program in which he or she functions, that functional environment. So when we look at the PLS-5, for example, I'm going to ask myself, first of all, whether or not this almost 6-year-old demonstrates a language delay based on performance on the standardized component of the PLS-5. And here we have these scores, and just picture them a little to the right here. Here you have these scores for the auditory comprehension, the expressive communication, and then the total language. And you'll notice the score for auditory comprehension, a standard score of 70, expressive communication 67, and the total language score of 67. We're going to talk more about the interpretation, but whenever you're thinking about a standardized test, what is the most important really is to think about the score that is right in the middle. And we work with these standardized tests all the time, so we understand when you see a score of 70, we already know that that score is 2 standard deviations below the mean, and we understand that scores that fall 2 standard deviations below the mean would suggest conceivably that the child has a language delay, possibly a language disorder. So when we look at these scores, 70, 67, and 67, certainly we're concerned conceivably about this child's developmental language skills. What we would say would be, in terms of developmental expectations, we would expect the child's standard score to fall closer to 100 if the child's language was developing consistent with developmental expectations, if the child's language development was within normal limits. That's not what we're seeing here, so we would think about whether or not this child will need maybe some supports in order to be able to get on the fast track in terms of language development. So does the child need specialized supports is the second question that we'll ask. But before we ask that question, the next question that we want to ask is, are there differences in terms of the receptive language, the auditory comprehension, and the expressive language, the expressive communication? And certainly for the PLS-5, you are able to calculate the difference between the 2 scores. In this example, the auditory comprehension standard score of 70, the expressive communication standard score of 67. Let me just write those in for you because those kind of moved a little bit here. And this would be a difference of 3, and the critical value would be 11 points, which tells you that a difference of 3 doesn't meet the critical value, so that difference score is not significant at the 0.05 level. Now, there was a question earlier about the growth scale value. Now, based on the raw score for PLS-5, you're able to associate a numerical value that you will then identify as the growth scale value. Notice 464 for auditory communication, and 452 for auditory comprehension, expressive communication. If you were to administer this test maybe 3 months hence or 6 months hence, and that is I'm mentioning 3 months because that is the interval that we recommend if you're using growth scale values to monitor progress. Theoretically, what we would hope is that based on the interventions we provided, that the growth scale values here would be higher than the growth scale value during the first administration. And then I've also mentioned that the PLS-5 will provide you with information on articulation and then also on the child's home language and spontaneous utterances. So based on the articulation screener, the child's score here was actually 13, which falls here 14 or less. And based on this child's age of 5 years, 11 months, that would tell us that we should consider strongly evaluating the child's articulation, administering a comprehensive measure of articulation. We also found that for the spontaneous language production, that the child's scores reinforce those relatively low scores for the auditory comprehension and expressive communication, and similarly the information from the parents also reinforced the PLS-5 results, pretty much telling us that effectively the child's language is delayed both in a spontaneous setting as well as in a more structured setting, and in the home as well as with you, the clinician. When we think about CELF Preschool, you'll be able to identify similar information. You'll be able to determine whether or not the child's performance indicates or meets criteria for a classification of language delay or language disorder. And when you think about CELF Preschool, you're thinking about this level, about these levels in terms of the assessment process. So at level 1, our task is to determine whether or not there is a language disorder. And if there is a language disorder, then we want to be able to describe the nature of the disorder. Is it a receptive language disorder, conceivably expressive language? Is it because of the content of language or the structure of language? So at level 2, we'll be able to become more specific, and becoming more specific really will help us to focus on the appropriate interventions. At levels 3 and 4, we ask questions about early classroom and literacy fundamentals. We use information from CELF Preschool-2 to describe the child's pre-literacy skills. And then for level 4, looking at the pragmatics of language, looking at language and communication in context. For purposes of our webinar today, I'm going to focus on levels 1 and 2. On levels 1 and 2, and I'm going to use some case study information to answer that question. Okay. So let's look at this child who is getting ready to enter first grade. She's 6 years, 1 month of age. And what we know is that she was previously diagnosed with a moderate to severe language disorder at age 5 years, 4 months. Now, one of the things that in my experience, and this is not always the case, and it depends on the resources that are available, but with the importance of Child Find programs, children who will score really low on either PLS-5 or CELF Preschool-2 often are children who were identified when they were infants and toddlers, right? So they might have theoretically been identified with a developmental delay and would have received services in early intervention programs. Now, for this child, we first diagnosed her with a language disorder when she entered kindergarten at age 5 years, 4 months. She is currently identified with a communication disorder and a specific learning disability and is receiving supports from the learning disabilities teacher as well as the speech-language pathologist and the occupational therapist. So when you think about SLP and OT, you're thinking about those services as being related to the services that she's receiving as part of that SLD classification. So we administered the CELF preschool, and here are the findings. And we wanted to look at the first question first. Based on the data, can we identify a language disorder? And so for that, we will use the core language information, the core language index, which I have presented here. And the core language effectively will tell us about her ability to interpret spoken sentences, which we assess with the sentence structure subtest, her ability to maybe think about morphological rules in completing sentences, that word structure task, and then expressive vocabulary, being able to label illustrations of objects, actions, referential naming, if you will. So you'll notice her core language index, and again, if you think about the midpoint for the CELF preschool, just like the PLS-5, you're thinking about the 100 as being in the middle of that distribution, the middle of that standard score distribution. And then for the scaled score distribution, think about 10 being in the middle of the scaled score distribution. So certainly in terms of the core language index, her overall language abilities, you notice a standard score of 63, more than 2 standard deviations below the mean. And then in terms of sentence structure and expressive vocabulary, those would be 2 standard deviations below the mean being 10, the standard deviation being 3, and then word structure a little bit more than 2 standard deviations below the mean. So again, depending on your criteria, you would consider that this child does exhibit a language disorder, and then we want to try to unpack to see if we could become more specific in terms of the nature of the disorder, which will allow us to identify appropriate interventions. In terms of the nature of the disorder at level 2, we look at certainly receptive language and expressive language. And I want you to take a look at these scores because on the surface, it would appear as if receptive language is better than expressive language. So you look at a standard score of 83 for receptive language and a standard score of 65 for expressive language. And certainly when you conduct your discrepancy analyses, that is what you will see. If I compare receptive and expressive, 83 for receptive, 65 for expressive, the difference of 18 points exceeds the critical value of 12 points at the 0.05 level. So the difference is significant statistically, and the difference is also highly unusual. A difference of that magnitude in that direction occurred in approximately 4% of children that age. However, here is what I want you to keep in mind. Sometimes when we look at the actual overall index scores, the index score doesn't always capture the variability at the subtest level. So when you look at the receptive language index, for example, and you look at the 3 scores that make up that, the 3 subtest scores that make up that index, notice that you have here a scale score of 11, which is close to the mean of 10. And then you also have for sentence structure a scaled score of 4. So you're going to need to become a little bit more specific when you describe her receptive language skills, because we definitely want to be able to identify her personal strengths and weaknesses with respect to receptive language. Sentence structure is a weakness, a relative weakness, and word classes receptive appears to be a relative strength. So you're thinking about those personal strengths. Whereas when you look at expressive language, this index score of 65, which as we know is more than 2 standard deviations below the mean, you'll notice that the subtest scores that contribute to expressive language, those scale scores are pretty consistent. So receptive language, it's important for us to recognize that there is a statistically and clinically significant difference between receptive language and expressive language, but it's also important for us to focus on the variability of the subtests that make up the receptive language index. Similarly, we want to take a look at language content and language structure. So if you think about expressive language, for example, is that weakness related to the content of language, or is it related to the structure of language? And certainly you'll notice these consistent subtest scores for language structure, thinking about morphology and syntax. And then for language content, notice that she didn't perform as poorly on word classes and concepts and following directions as she did on expressive vocabulary. So again, when you think about expressive vocabulary, and in the manual we'll describe certainly some of the important abilities that contribute to successful performance of the expressive vocabulary task, certainly understanding the verbal directions, then also being able to retrieve from long-term memory those phonological codes. So again, there are a number of abilities that could conceivably impact performance on expressive vocabulary. But again, when we look at those discrepancy comparisons, you'll notice for language content and language structure, the 14-point difference again is significant statistically, exceeding the critical value at the 0.05 level, and a difference of that magnitude occurred in approximately 7%, if you will, of our standardization sample. Now, I mentioned statistical significance and clinical significance a minute ago, and I want to just focus on that for a second. We talk about the significant difference here based on the critical value as indicating statistical significance. So this is a true difference. It's not a difference that is the result of measurement error, for example. This is a real difference, so we want to make sure that we focus on it. And then the prevalence or the base rate will tell us about clinical significance. A difference that is relatively rare, meaning that it occurs in a small percentage of our standardization sample, will tell us that that difference is highly unusual, meaning that we need to consider that when we're making recommendations for treatment. So the question that's often asked is, so what is a prevalence rate or base rate that would be unusual? And different researchers have different cutoff criteria. I think the prevailing understanding of most researchers is if you think about 10%, a different score that occurs in 10% or less of our standardization sample would be a difference on which we want to focus. Other researchers talk about 15%, but certainly in our example here, these are differences on which we want to focus. Of course, keeping in mind that caveat with respect to receptive language, the scatter or variability in the subtest scores. So effectively, when we're describing the nature of the disorder, I want to make sure that I focus on receptive language being higher than expressive language, but I want to make sure that I couch that by considering the highs and lows when I think about receptive language. And then I also, when I look at language content and language structure, language content is a strength relative to language structure. It's definitely not a normative strength, but it's a personal strength relative to language structure, but both effectively are delayed. So again, when you think about the needs of this child, certainly you're going to think about receptive language, even though receptive language, that overall score is in the 80s, but you want to think about the relatively low score within receptive language, and then also about language content and language structure. So when you think about the final part about the interpretation, I mentioned this already, and certainly any standardized test, not just PLS-5 and CELF-2 preschool, any standardized test will really always, any standardized test that focuses on constructs that are normally distributed will use a normal distribution like this and will actually draw our attention to the score that is right in the middle of the distribution. So when you think about the collection of standardized, when you think about the collection of data during standardization, effectively what test publishers do is they analyze the data and they identify a raw score that effectively divides the sample in half. So this would be the point in 50% of our sample would score above that point and 50% would score below that point. So the score that is right in the middle of the distribution is actually the score that is of interest. And every child's score is described in relation to that mean score. So for the standard score, where you're thinking about a mean of 100, standard deviation of 15, certainly you're thinking about 115 as being one standard deviation above, 85 being one standard deviation below, 130 equidistant, 130 and 70 being equidistant from the 100, and so on. Similarly, for percentile rank, the 50 that is right in the middle of the distribution will correspond to a standard score of 100. So when you think about describing children's scores, we always think about describing them in relation to the mean. So for PLS-5, where you're thinking about standard scores, 100 being the mean, 15 being the standard deviation, certainly these would be the distances from the mean. For CELF Preschool-2, you'll have a similar distribution, except in addition to your standard score with a mean of 100, you also have a scaled score for the subtests that have a mean of 10. But again, you're thinking about the score that's right in the middle and then describing the child's scores relative to that mean. So 13 being one standard deviation above the mean plus 1, 7 being one standard deviation below the mean, or minus 1. So that's pretty much this here. You have the standard score consistent with PLS-5, and then your scaled score, 10 being the mean. So in terms of the actual score differences, so I've talked about the format of CELF-2 preschool, the format of PLS-5. So what if you were to administer both of these tests to the same child, and you might find different scores? And there was a question where there's a question that's coming through, and I'm hoping that I'll answer that during this segment. So when you think about these score differences, it is certainly possible that the child's language abilities are different. It is also possible that the child's performance was different on both of these tests. There are a number of child characteristics that could impact the scores. For example, if I was more engaged during PLS-5, for example, I wasn't able to focus my attention during CELF-2 preschool. So there are a number of child characteristics that could potentially explain different scores, but there are also a number of characteristics of the test on which we want to focus. One to which I want to draw your attention would be the characteristics of the normative sample for CELF Preschool-2 and PLS-5. We collected our data for CELF Preschool-2 in 2002. The data for PLS-5 were collected in 2012. By 2012, the makeup of the U.S. population had shifted. You'll notice here in terms of race and ethnicity, we had approximately 62% of our sample were described as white. 54% were described as white for PLS-5. One of the reasons that is important is because if you use these two instruments, you know that both of these will allow you to give credit for responses that are dialectal variations of English. However, when you think about the demographics of race and ethnicity, it is likely that more children in the 2012 PLS-5 sample used a dialectal variation of English compared to the children in the CELF-2 sample. Another thing that you want to think about when you're trying to explain some of these differences in scores might be the correlations between the PLS-5 and the CELF Preschool-2. During standardization of PLS-5, we actually conducted a study of the relationship between these two instruments. So we had a sample of children, and we administered both of these tools, PLS-5 and CELF Preschool-2, to each of the children. Some of them took PLS-5 first, some took CELF Preschool-2 first. In terms of our scores, what we wanted to see was both of these tools, we know, assess aspects of language development. So we wanted to see if there would be a moderate to high correlation, which is what we would predict because of the content that they share. And as expected, the adjusted correlations ranged from 0.70 to 0.82, so moderate to high correlations. But what you'll see in terms of the means is that on PLS-5, you'll notice that the means were slightly higher than the means for CELF Preschool-2. And there are possibly a number of explanations for that. There are maybe because there are fewer subtests on PLS-5 than on Preschool-2, and short forms tend to produce higher scores. But because of the correlations, what we want to keep in mind is that these correlations will suggest to us that a child who will perform poorly on PLS-5 is also likely to perform poorly on CELF-2 preschool. The other thing I talked about earlier is the format of the test. Another explanation for different scores might be the test format. So you want to take a look at that. So how do you decide which test to use? Well, look at the referral question, right? So if you are thinking about a survey of developmental language skills and you're thinking about gaps in developmental language skills, then think about PLS-5. If you're thinking about language in relation to the mainstream classroom, think about preschool, CELF Preschool-2. Okay. So I do want to tell you, especially speech-language pathologists, I mentioned that CELF Preschool-2 was published in 2002. We are working on CELF Preschool-3. So if you have any interest in helping us collect data for standardization, we would appreciate you joining us. And I have this, but you can go to our website and search for field research, and we would be thrilled if you would join us to help us collect data for standardization of CELF Preschool-2. Okay, I know I'm a little over. There are a number of questions that came in. I will answer those questions. I'll respond to you in an email. If you have any other questions, send them my way or go to our website. And then we also included here at the end the information for ASHA CEUs. Okay. When is the third edition expected to come out? We're collecting standardization data now. It typically takes a while for us to analyze everything. So I don't have a projected date of publication on that one yet. Thanks everybody for joining us, and sorry I kept you just a little over time, and I will get to the questions individually and send you an email to the email address with which you registered. Thanks everybody for joining us. We look forward to having you join us on other webinars in the future.